Hey, everybody, and welcome to a new episode of Frank About Health. Today is Thursday, the 29th of June, and I am just saying that we are going to talk about a brilliant company named Thatch, and it is a new way to do healthcare. Now, that being said, this is about a venture, and as such, even though I'm going to focus on today's episode about the healthcare concepts that are going to benefit employees, consumers, and patients alike, this will be followed up on Friday on Intangify with Matthew Asbell, who will be able to look at the venture's vision. And he is, of course, joining us today because a lot of the information will be shared is predominantly in the healthcare focus, but anything related to intellectual property issues, legal issues will be commented on as appropriate because, as you all know, I like to issue my weekly disclaimer so that everyone knows that I'm just providing food for thought for everyone to make their own best healthcare decisions going forward. We're not here to dissuade you from doing your ongoing treatment protocols, medications, specialists, or doctor visits. We want you to be able to use this as food for thought so that if you do make any such decisions, you consult with those people based on what you've heard here today and make your decisions accordingly. That all being said, I want to first give a brief history of healthcare financing in our society over the last 30 years in particular. We all know that traditionally in the United States, all of us obtain our healthcare benefits through our employer. If you're self-employed, you're able to get your own plans, or even while you are employed, you can also get health savings accounts, financial savings accounts, or even have your own emergency savings fund if possible. But a lot of that always seems to go by the wayside for life's reasons. Life goes on, and most people are traditionally healthy as best as they can be. It is the chronically ill that at some point have to have healthcare as a major investment in their quality of life as well as in maintaining their lifestyle. Now, that being said, 30 years ago, around the time of the Clinton administration, we all remember our First Lady Hillary Clinton was trying to create legislation for her own form of healthcare reform, which did not pass. And then subsequently, 20 years later, we ended up with President Obama and the release of Obamacare in 2013. Now, all of that has always created a lot of controversy and conclusions that may or may not have been accurate. But as such, we have discovered, especially with the innovations of artificial intelligence and other technology systems, especially after COVID-19, that the best thing is for a lot of individuals from an entrepreneurial vision to come up with a solution that can help supplement or complement what already exists within our employee benefit plans. So today we're going to talk about an interesting company. I'd like to show you what they look like. Thatch. Now, Thatch is defined, as I understand, and correct me if I'm wrong, Chris, it's defined as an outer covering or a layer of protection on houses, sometimes on grass, and other kind of fixtures. But in this case, I can see the value that that name and that company has with employees' healthcare. So that being said, Chris Ellis, the founder of Thatch, I'd like to introduce you to this episode of Frank About Health. And then I'd like you to just explain further a little bit about what I've been talking about, especially with your company's name.
Well, thanks, Frank. It's great to be here. Chris Ellis here, CEO, co-founder at Thatch. To kind of give you the 1,000-foot view, Thatch is a new way to do healthcare. Our goal is to help companies give great healthcare to their team in 5 minutes. And the way it works is almost like a 401k for healthcare, where an employer can set a budget that they want to spend all in for all of their healthcare expenses. And then employees can use that budget to personalize their healthcare experience, whether that's buying insurance, paying for out-of-pocket expenses, or trying new digital health products and services that come out every day. And this is made possible, kind of thanks to that tee up on the regulation, by a new law that passed a few years ago called ICHRA, or the Individual Coverage Health Reimbursement Arrangement. So excited to be here. It's the big picture on Thatch, and look forward to the discussion.
Oh, absolutely. So tell me about yourself, Chris. What is your background predominantly in healthcare, or is it more in financial and technology, and then you wanted to use your passion for healthcare to integrate it? Give me an overview.
Yeah, great question. I always knew that healthcare is the area I wanted to make an impact. I lost my father to cancer very early on in my life, and realized pretty early that that was something that was really important to me to improve the patient experience, and just knowing how much healthcare impacts people and their families. I went on to do cancer research in undergrad and later grad school at MIT, but started getting the itch of, I want to start something of my own one day. And so, not sure exactly what form that would take, I joined a startup. And at the time, this is a European company doing clinical software that helps hospitals find treatments and clinical trials for cancer patients. They were just expanding into the US. So I ditched the lab coat and donned the suit, started a sales team, and went door to door, slinging clinical software. Learned a lot then, kind of about how much financial decisions really impact patient outcomes at the provider level in terms of the tools and the equipment they use, the software, but also got a really interesting lens into the wider world of healthcare regulation in the US, which is a fascinating and very confusing topic as you're first getting started. And kind of wanting to see more kind of how like a big discipline company does go to market, develops products. I joined a biotech called Agilent, and I was on the software product team there. And as I was learning more and more, I kind of becoming really fascinated by these new regulations that were coming out. A lot of them focused on increasing access of consumers to their own medical data, or really like new ways to think about insurance and individualized healthcare, which we'll talk a little bit about in a second. Became really fascinated. I felt it was the right time to go out and try to build something that was really patient focused or consumer first. And at the time, I had not exactly the right idea of like what shape that would take, but I ended up meeting my co-founder, Adam Stevenson. So my background is in healthcare. He actually started his career in health insurance. He was a software engineer at Humana, and then later, led multiple technical teams at Stripe, where he was a relatively early employee. And so he's, an expert in the financial services and fintech side. And I just saw he had a really fascinating profile. So I had cold outbounded him kind of on a whim, and said, hey, I'm trying to learn about APIs in healthcare. And when we met, we had instant connection. We'd actually both lost parents to cancer. We were both ready to leave and start something new. And we really knew that the impact that we wanted to make was on, ultimately the way that people interact with the healthcare system, not the physicians or the insurance companies or the pharma companies, because that's where I kind of spent my whole career. And so, when we left our jobs, we weren't sure exactly, what form it would take. And so we went out and we actually talked to a bunch of people who are using the healthcare system. And the thing that we kept coming up, like regardless of the illness or regardless of like the age or the circumstance, was just the financial experience in healthcare, like, is just really bad. Paying for healthcare sucks. People don't really understand, how they use their benefits. They don't understand what they're going to pay when they show up. Prices aren't very transparent. It's a big total mess. And we kind of realized like, hey, this is like the space that we're really interested in. And when we started building a team and we raised, venture capital in early 22, we started experiencing the problem of the financial experience through the lens of a business. And we were trying to get healthcare set up for our team. And we knew it sucks for consumers, but on the business side, it's something where, it's our second biggest cost after salaries, health insurance and benefits. The typical founder of a small business spends 50, 60 plus hours every year administering plans, becoming an expert on health insurance and all this. And even though we spend all this time and money on it, like I said, the experience for employees is still really bad. And so that's kind of insane.
Yes.
And as we were digging into that problem, we learned about some of the healthcare focused payment rails like the HSA, the FSA, the HRA, which in theory can create these just really compelling experiences, like get a discount on all your out-of-pocket spend, or in the case of the individual coverage HRA, an individual can purchase their own insurance policy and by extension choose their doctors and prescriptions. But even though these sound, great in theory, in practice, they're kind of these boring legacy technologies. They haven't seen a ton of innovation. It's like the alphabet soup of healthcare. Everyone's eyes start to glaze over when you talk about it. And there's just a lot of complexity there.
Absolutely.
And so our insight, and we're really fortunate to have such a great team with really strong domain expertise in fintech. And so our like Stripe and Shopify, Robinhood, and our insight was just how you have these great new, financial services companies like, Brex or Ramp build on top of new infrastructure like Stripe and Plaid to create these compelling experiences in expense management, financial automation. We saw a huge opportunity to do the same thing for healthcare. And so the platform that we set out to build was one where we could solve the problem of the business owner, which is they want to save time. They don't want to become benefits experts. They just want to set a defined budget, sign up in 5 minutes and be done with it. But then also solve the problem for the employees, which is now I have some control over how I use those dollars, whether that's to purchase health insurance or pay for a therapist or cover my prescriptions or, what have you. And move away from this model that's like one size fits all. And everyone's kind of, a little bit unhappy, to one where everyone has their own unique experience. It's simplified and personalized so that people can actually take ownership over their health. So that's the big picture on Thatch and kind of why we founded it. And happy to, share more about our journey there.
Oh, no, absolutely. But was I correct in the assumption of why the name Thatch, as a way of protecting the house or protecting the group, which
That's
is the
very
business
good.
in this case, right?
Yeah,
Okay, I like that.
Our original thought was, we're in healthcare. It's one of the industries that's the most fragmented, where there's all these different, there's the health insurance companies, there's the pharma companies, there's the hospital, there's the patient, there's the employer. And the data is all over the place. It's in all these different, and just how, the individual blades of straw or hay that go into the thatch roofing by themselves have little value. They're weak and flimsy. Our vision was, if we can actually bring together all of these different data sources, all of these different modalities that on their own aren't significant, but when you put them together, actually have structure and form, then there would be an opportunity to provide this shelter for the consumer. And so that was the big picture for the name. So appreciate it.
Well, it's a perfect start to the whole nature of our conversation, because as I always talk about here on Frank About Health, everybody is unique with their own healthcare problem and therefore their own healthcare treatment that may differ or vary in some way, especially if they are in a chronically ill population. But the thing is, just like not one size fits all for your treatment, not one size fits all for your coverage. So the way that Thatch seems to have gone with the individualized vision I think is on point. And I'm looking forward to discuss that in our next segment more in detail, as far as how, I guess, currently the user experience is predominantly the employees of a business, but I gather you're going to be growing that into something that individuals can participate in, or even if they have a startup of their own enterprise, they themselves can get involved in it directly. All right, so ladies and gentlemen, when we return right here on Frank About Health, both on talkradio.nyc, as well as twitch.tv, Facebook, YouTube, LinkedIn, and Twitter, we will be back to really go into the nuts and bolts with our legal consultant, Matthew Asbell, host of Intendify, right here on the network. And we'll be back in a few.
Are you a business owner? Do you want to be a business owner? Do you work with business owners? Hi, I'm Stephen Fry, your small and medium-sized business, or SMB guy, and I'm the host of the new show, Always Friday. While I love to have fun on my show, we take those Friday feelings of freedom and clarity to discuss popular topics on the minds of SMBs today. Please join me and my various special guests on Friday at 11 a.m. on talkradio.nyc.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
What really drives success in business? Introducing Intangify, the show that explores the intangible assets that create value and growth. I'm Matthew Asbell, your host and an attorney focused on innovation. Join me Fridays at noon Eastern to discover how innovation, culture, and other intangibles shape thriving companies from startups to established businesses. We'll share strategies to unleash your business's true potential. Tune in live on talkradio.nyc Fridays at noon Eastern and Intangify your business today.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Hey, everybody, and welcome back. This morning, I am actually at NYU's Grossman School of Medicine, courtesy of NYU Langone Health. I thought this would be a perfect setting for our discussion today because this, for me, is an education, as well as since I've been involved in healthcare for the last 20 or so years, I definitely am very much interested in having the discussion with Chris and Matthew about pretty much Thatch and what it's looking to do for our healthcare situation going forward. Now, let me ask you, Chris, before we go into the discussion of your organization, what kind of impact did the COVID-19 pandemic have on the building of your organization? Because I think you mentioned you had done this over the last 3 years or so, right?
Yeah, that's right. We actually founded Thatch, October 21. And so kind of in the full throes of COVID. I think it made a lot of impacts. The one that I think I can point to most coherently would just be the fact that we had a virtual first mentality from day one. So I currently live in Austin and I'm the only person in the state. Our team is all over the country, and we really kind of had in our DNA this more kind of virtual remote first mentality because we couldn't get together in person.
Right.
And so from a team perspective, that played a pretty big impact in how we were distributed. And today, we've kept with that model and have really, enjoyed the benefits of being able to have people all over the country work with us.
Awesome. So when I can see from your own personal experience in dealing with loss through cancer, as well as having your research experience in understanding from abroad different healthcare methodologies, and then meeting your co-founder who has the insurance industry experience, I can see the ecosystem forming that made this a natural fit for Thatch to become part of your venture. Now, my question is, from a healthcare perspective, was it you trying to live out the feeling of loss that you may have experienced, so your father passing on, or was it also driven by your sense of advocacy for taking care of those that were chronically ill? What was your driver to really get your teeth, sink your teeth into Thatch?
Yeah, it's a great question. My personal experiences really changed the way I think about how much people's lives can be impacted by their healthcare experience. And I always knew that the industry that I wanted to work in was healthcare, but I didn't know always like the way that I would make that impact. And I had, first thought about, I'll be a doctor. And then I thought, but if I create a new drug and I do science and have a new discovery, that will impact people in a different way. And one of the kind of realizations that I had is if you look at like basically every other industry, software is like the most scalable and efficient way to drive like exponential, massive change in an industry. And I felt very strongly that like the best way to build software and scale it was through like a venture-backed technology company. And so when we founded Thatch, it was trying to look at the intersection of those two circles, which is how can we improve the healthcare experience for consumers, for patients in the healthcare system, but also build like a venture backable technology startup that is at its core a software company. And as it turns out, like the intersection of that Venn diagram, there's not that many like opportunities there. And so because you have that constraint and that forcing function, you're able to quickly throw out like quite a lot. And for us, we really view the kind of economic model of Thatch as being directly proportional to the quality of life improvements that individuals will have as they're, enjoying the healthcare system, hopefully. And, to your point before, I think the personal experiences I had really colored my judgment to focus on this Venn diagram and kind of this desire to make the world, a better place for the, next generation and the folks who come after me.
Well, you were literally at the right moment in time. I mean, when the whole world was, well, let's just say within the United States, when the United States was literally on lockdown, all of our minds were focused on our healthcare. So you were in a total market is what I call it. And then from your own experience, I think the kind of term that I like to call it is SROI, the social return on investment, for what your venture was going to bring back to you to feel that you're accomplishing from whatever your own circumstances led you to strive for, But I think at the same time, what I always find interesting is when people say the word healthcare industry, I really don't know how to define that. Are you talking about the professionals in the industry, the pharmaceutical companies, the insurance companies, or just the patients themselves? Because we represent, depending upon what our illness is, we can represent a commodity or we can represent a real hardcore investment, depending upon what the procedure is. So it looks as though that Thatch is already using the existing employee-sponsored business model of providing coverage for their employees, but you're expanding it so that the individual has more ownership over their healthcare. And I think that to me is very inspiring. So I know one of the questions I was going to ask you was what kind of market were you trying to cater to? You're really catering to everybody. But I think when you're segmenting it out, especially in the startup phase, you're looking at the chronically ill. The chronically ill are the biggest users or consumers of healthcare. So what kind of illnesses were you focused on? Was it cancer or was it other illnesses that also have a big spend?
Yeah, great question. In the very beginning and early stages of Thatch, because of our own experiences with cancer, those were actually the population that we first talked to kind of get the original inspiration for Thatch. And it was interesting in there, given how much especially in cancer, how aggressive the costs are, we realized like pretty early on focusing on that segment that like the financial layer there impacts outcomes to such a great degree. And, I think just to kind of like give an example, like if there's a single thing that drives worse outcomes uniformly across the broadest range of illnesses, and that's not just cancer, it's like more than where you live, where you work, your background, it's actually like your insurance and how much it covers. And so the underinsured, the uninsured, experience dramatic differences in outcomes across like a wide range of illnesses. And so to name a few, in cancer, you'll typically have worse outcomes, die prematurely, catch the cancer later because there's less early diagnostics. In chronic diseases like diabetes and HIV, they tend to have worse clinical outcomes. In the context of mental health, folks are less likely to receive services and care consistent with clinical guidelines. And so in the United States, having the right insurance like really matters. And yet only about 14% of Americans can even define like the most basic terms of insurance, like deductible,
Yes.
out-of-pocket max, et cetera. And so we saw this huge gap in the outcomes that people have due to their insurance and their ability to actually be educated and understand it. And part of the structural problem there, like to your point, is the employer is the one that pays for health insurance. And traditionally, they're the one that actually chooses health insurance. And so the patient or the consumer is the one that actually ends up using it. But all of the decisions are made kind of without their knowledge. They don't even know how much it costs. They don't know what really inputs into the employer's decision. And so our line connecting the dots from the chronically ill into selling to companies who will then cover their employees through Thatch and be able to pay for healthcare through Thatch is we really want to change the equation from the analogy I like to use is like right now, there's one pair, the employer has to find one pair of shoes that fits the entire team. So it's like size 10 Nike, that's like about what everyone needs. And then it's like, well, hey, I'm a size 12 or like, oh, I've got small feet. And so instead we want to move to a world where they just give you a budget, you go find your own pair of shoes, and Thatch helps you figure out kind of what's the right pair of shoes for you. And so thinking about understanding the individual situation, like what doctors would you like to see? Do you have any medications you're taking? Are you suffering from any chronic illnesses? Is mental health something that you're actively pursuing? And using software and technology, actually taking those parameters about the individual and serving them up the right combination of healthcare, which is health insurance or supplemental benefits, out-of-pocket expenses that works for them. So that's kind of the high level of how we connected the dots from the chronically ill and into the broader product that we're selling to employers.
Right. No, and it makes perfect sense. I figure though that while everybody's eyes were on a pandemic like COVID, healthcare became a natural desire for everyone to look into in terms of better ways of paying, better ways of treatment, better ways of communicating. So it looks like to me that Thatch is definitely meeting patients' needs through all of those various issues, especially the part about having a mediator handle all of the different choices to make when it comes to taking care of their healthcare plans and funding mechanisms and stuff like that. Matt, you're asking a question. By all means, unmute and share it with us.
Well, it's not a question so much as an observation, and it doesn't really relate to my role on the show. But as I've listened to you, I mean, basically what I've heard is, you're creating a tool for self-advocacy.
Yes.
And the gap has been that, at least many of us in the current healthcare system, myself included, we have to advocate for ourselves in terms of making sure that we catch something early. We go to the right doctors to be seen for the right things, and but many of us are not deeply educated in the area in order to know what we should be doing. And I had a scare like that in a year or two where personally where I had my own view, and then I was being told this is how I have to deal with it, and I just have to trust. I don't have any other avenue, and I can't make decisions. I can't trust with how those decisions are made, because I assume those decisions are made from financial perspectives of the providers, from insurance, epidemiological considerations, which I have no idea what they are. So at least to some degree, you're satisfying that aspect of the need for self-advocacy.
Right. And at the same time, it becomes a re-education of sorts, because as we've been talking about what happened in the last 30 years with our government making so many widespread changes, a lot of people do benefit from them, but there are those that probably don't even need the health care because they see the doctor once a year for their physical, and that's just about it. So it becomes an issue of expense only in their mind, and they don't see the bigger picture. As Chris, you've been perfectly outlining for everyone. We're about to take our second break, but when we return, I'd like you and Matt both to walk through the business model with me as if I was an employer about to enroll in Thatch. What would I do with my employees Where does artificial intelligence play a role in it, as well as just in general? Where do the doctors come in? So when we return, everybody, on this episode of Frank About Health, we're going to really take a deeper dive into Thatch. So please stay tuned. We'll be back in a few.
Are you passionate about the conversation around racism? Hi, I'm Reverend Dr. TLC, host of the Dismantle Racism Show, which airs every Thursday at 11 a.m. Eastern on talkradio.nyc. Join me and my amazing guests as we discuss ways to uncover, dismantle, and eradicate racism. That's Thursdays at 11 o'clock a.m. on talkradio.nyc.
In a post-COVID world, you may have many unanswered questions regarding your health. Are you looking to live a healthier lifestyle? Do you have a desire to learn more about mental health and enhance your quality of life? Or do you just want to participate in self-understanding and awareness? I'm Frank R. Harrison, host of Frank About Health, and each Thursday, I will tackle these questions and work to enlighten you. Tune in every Thursday at 5 p.m. on talkradio.nyc, and I will be frank about health to advocate for all of us.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on talkradio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on talkradio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Welcome back. And yes, Matt, before our break, when you started talking about how Chris had been discussing a self-advocacy platform, that's essentially how I developed Frank About Health. My situation, I can say, is similar, but in the following way. My father has been dealing with cancer recovery for the last 12 years. And thankfully, he's on a very high-profile medication that was grant funded in order for his particularly prostate cancer to be reduced and maintained. He's now going on 93, and to be treated with all of the benefits of research, advocacy, information, hopefully getting the best insurance or grant coverage you could find, and working with a team of doctors that really know their stuff. You end up not only looking for the cure, but fighting for it. So advocacy is, I think, the main reason why anybody would be involved in a program like Thatch. Now, as such, I do run a business of my own where my property are healthcare properties in particular. And I would like to, I'll be honest with you, I would like to learn how to participate in Thatch. So give me a run through as if I'm a chronically ill patient from the perspective of being an epileptic who's under seizure control, but I have my medicines and I have my insurance and I have my Medicare and I have my disability coverage and all this other stuff, but I still have a gap that I have to figure out a way to pay. So that being said, I'm probably one of your targeted clients. Run how Thatch would be proposed and coordinated with my efforts in my organization.
Yeah, the way I like to kind of paint the picture is there's really two stakeholders that we're serving, and one is the business, so someone that is a founder or business owner that needs to provide good health services for their team, and then the second is the actual experience of the consumer. So I'll just start quickly with the business side so that you can get a perspective of why this is intriguing for a company.
Sure.
And for us, it was really solving a problem that we felt ourselves as owners of a small business. And when you think about the modern technology stack, for most things like email, communications, video conferencing, there's a really super intuitive, delightful set of solutions. But when you get to healthcare, it has one of the lowest net promoter scores of like any product in existence. And
Yes.
it's kind of insane because it's also the most expensive business purchase that a company makes besides their payroll. And so when we talk about like who the market is that we're serving, I want to draw a kind of distinction between the super enterprise, 100,000 person companies like a Google or Amazon, because their experience is very different from the typical small business. They've got a lot of leverage. They have group purchasing power. They're able to extract a lot of, concessions from insurance companies and from benefits vendors. But what about the 99% of companies that like aren't, 10,000 plus enterprise companies? Their experience is actually pretty painful. When you look at like a small business, they have to go and schedule time to talk with a health insurance broker, which, by the way, is like the health insurance brokerage industry is a $200 billion market that nobody's heard of. You have to talk to a person, trade PDFs back and forth, make a decision ultimately with incomplete information, which is like, I don't know how much other companies are paying. I don't know what's like the right coverage for my team. And a business owner, in addition to like running the operations of a business, has to become like an expert in health insurance, which is kind of insane for small teams that's a requirement to run a business in the US. Nowhere else in the world, any developed country, does that make any sense. And so once you end up making that decision and going through all the hoops, you're still in the situation where your team runs into these issues, whether that's the plan doesn't cover the doctor they wanted, or they didn't know what they were signing up for. Now they have all these out-of-pocket expenses. Maybe they live in a state that doesn't have mental health coverage, doesn't cover a particular procedure. And the employer is receiving those kind of complaints, and they aren't really equipped to answer or have any tools to actually support their team. And so the ongoing cost to administer and manage the health plan is considerable. And then every year, the rates go up and they have to pay more and more. And that's to some extent out of their control. And for that reason, something like 30-40% of small businesses don't even offer healthcare at all, because there's just so much friction and it's hard to. And so the gap that we ultimately wanted to solve from the business side is make it really dead simple for people to get healthcare, in 5 minutes and get it set up for their team, and have the confidence to know that the solution for their employees is actually going to be one that they actually like, and they can have this experience of almost working at a really big company, even though they're at a small business. So for the business, it's ultimately time savings, the lower cost of administration, not having to develop that expertise in-house, having kind of Thatch to rely on. Now, that's how we grow as a company solving a business need, but you can't ever really build a sticky product that people will want to renew on unless the experience for the employees is good. And so at a really, kind of high level, what we wanted to do, and kind of like the big thing that we think is really innovative, is moving away from this model where like every employee gets the exact same package and setup of benefits, to one where instead they receive like raw dollars that are tax exempt and advantaged from a taxation perspective, and they can use those dollars to curate a healthcare experience that makes sense for them. And so just to narrate a couple of examples here, let's say an individual gets $500 a month from their employer for healthcare. They might be planning on having, a baby that year, and they want to allocate all of those dollars towards a platinum, really full service plan that they know is going to cover all of their, emergency visits, et cetera. But if they're not planning to have any healthcare expenses that year, alternatively, they can opt for a less expensive plan, say, $400 a month, and use the $100 a month left over to buy something like a therapy appointment or services that maybe aren't covered by their insurance, so that they can prioritize the specific thing that matters to them, like mental health. And then the second piece, for a lot of folks who are, let's say, younger or are not having to have planned for medical expenses for years, being able to pocket some of the difference, put it into a health savings account so that you can save and invest that money tax-free and have it grow over time. And yet another situation could be that someone decides to get a less expensive plan and a concierge doctor or a One Medical membership. And really, the goal for Thatch is to not put all of that burden on the employee to figure out like what's the right combination for them, but rather using machine learning and recommendations to actually like understand in general your kind of profile and recommend to you based on some basic information about yourself what's right for you. Because I think it's, a very lofty goal to try to educate everyone on all of the intricacies of how insurance, et cetera, works. But using software, we can personalize ads to you, we can personalize tweets to you, we can do all these things, but healthcare, which is the most important part of our lives, is very little personalization. So our goal is to bring that personalized experience using software, using technology into the everyday life for consumers.
Matt, I believe that those are some of the comments that you're addressing. Do you want to voice them? Because I definitely agree with you.
Yeah, sure. There is, I don't know if this is a sort of a widely accepted concept, but this, my view is that in the United States, we have the curse of choice. And, lots of software platforms and other things out there are about giving us more choice. Choice is a great thing. We love choice. We love to have choice. But when we have choice, we really struggle with making the right choice. So, it's one thing to say, hey, look, I'm going to make it easier for the employee, for the consumer, the patient, to decide how to allocate the funds available to them through their employer, because they know what their plans are. They know they see a therapist, right? They know they have a chronic illness and they have to get this medication or whatever it is. And so they can make choices and can plan. But there are, all sorts of unpredictable things that happen. And other needs that you're going to have. And currently, like if you take a typical FSA kind of program where we invest a certain amount of money, we have to decide how much money we want to put into that program at the beginning of the year. We don't know necessarily how we're going to use it unless we're someone who has a chronic illness or, who's sort of forced into having a particular need. So we're given that choice. How do you want to do it? Every year I put money into an FSA and I go at the end of the year, I'm in a mad rush to use it up because I didn't predict the right amount. Because how am I supposed to predict what those needs are? So I think that AI aspect of, hey, we're going to look at your profile we recognize it's not going to be perfect, but based on what we know about you, we're going to help you think about and plan and decide how to allocate those funds. And then you can tweak it if you want. You still have choice. But it's guided choice.
Right. Well, actually, that's what ThatchBot is about over at Thatch, right? It helps the user of the program that their employer has participated in to make the choice of their budget and their plans and their problems about claims not being met on time or whatever the circumstances may be. Correct?
That's right. Yeah, the goal really with large language models in our business is to get the kind of personalized advice of a broker that a broker might give to an employer or an advocate might give to a patient, and train it on all of the instances where an individual might need that help and have it be able to be delivered at the right time so that they can get the timely advice.
Interesting. Well, we're about to take our final break, but at the same time, there's still more questions that I've generated from what you've just said, because now I was listening also from the user side, and we'll definitely talk more about that when we return right here on Frank About Health on talkradio.nyc, all of our social media, so please stay tuned. We'll be back in a few.
What really drives success in business? Introducing Intangify, the show that explores the intangible assets that create value and growth. I'm Matthew Asbell, your host and an attorney focused on innovation. Join me Fridays at noon Eastern to discover how innovation, culture, and other intangibles shape thriving companies from startups to established businesses. We'll share strategies to unleash your business's true potential. Tune in live on talkradio.nyc Fridays at noon Eastern and Intangify your business today.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on talkradio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on talkradio.nyc.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey, everybody, welcome back. Just want to thank both you and Matt for being here today. I mean, I am obviously looking at this particular episode from a personal viewpoint as well as an educational one for my listeners and viewers out there. I mean, let's face it, our healthcare system in the United States in particular is, I don't want to say the bottom of the barrel, but it has had some improvements. Yet right now, when we're in an innovative time in our history with Zoom and AI and genetic programming for medications and finding cures for things like cancer, it's just important to understand that there are other gaps. There are other solutions for the gaps that currently exist, and I think that Thatch is definitely on the forefront of it. So, Matt, your conversation about choice was very on point. Thank you for that. And I know you're going to be leaving shortly. I just want to let the viewers know that this conversation will continue on Friday at 12 noon right here on talkradio.nyc. It'll be a live stream. So those viewers on twitch.tv, I know you've been making comments on my show lately. Hopefully you'll be able to make comments on Intangify as well, because this is definitely something that is going to benefit all the viewers and listeners of both Frank About Health and Intangify. Now, Chris, basically, I'm seeing that, you know, you've got a very good business out there for the chronically ill as well as for the employers and ways of being able to integrate their existing conversations with insurance providers and other financial assistance programs. What about those that are not chronically ill? What about those people that really could take or leave whatever Thatch is offering? Are there plans for Thatch to take care of their medical incentives or their needs that are not urgent?
Yeah, great question. You know, one of the things that we reflected on as we were talking with a bunch of patients who had these just overwhelming medical bills, you know, medical debt's the leading cause of personal bankruptcy in the US. And one kind of realization was that the universal truth of healthcare is like costs are going to continue to rise, and there's not a lot of education about how significant these costs can ultimately become as you get later in your life. And it's almost an inevitability where, you know, the typical couple needs, you know, hundreds of thousands of dollars in retirement towards their medical expenses. And so one realization early on was for individuals who are, you know, earlier in their lives, who are not big users of the healthcare system, more folks should actually be saving for healthcare. And you think about the 401k, which is like almost universally offered and everyone, you know, contributes to it. And it's like a regular fact of life, so that we can have a nest egg in retirement. We really think more people should be saving for their health expenses in retirement. And so one of the early kind of vehicles that we looked at to do this is the health savings account. And so for folks who are young, don't have healthcare expenses, one of the cool parts about Thatch is, remember, we get this budget, and in the absence of a health savings account, or if you could only allocate that budget to insurance, everyone's default mode is like, I want to get the most expensive plan with the lowest deductible that covers the most stuff. But for many people, it's actually much more efficient and cost effective to get a much less expensive plan that will cover you in the event of an emergency or something bad happening. But then being able to pocket that difference into a tax-free account, the health savings account that can be invested and grow tax-free over the course of your entire life. And when you think about the 401k versus the HSA, there are more tax advantages to put your money in a health savings account than a 401k. And so it's something that acts as kind of triple tax advantaged. People like to say, where it goes in tax-free, it accumulates tax-free, and you can pull it out tax-free for healthcare expenses. And so for folks that are, not chronically ill and are healthy, I think having that mindset of like, someday I will be using the healthcare system a lot, and I should be prepared for that moment when it arises, and we make it really easy for folks to do that.
Is there a long-term care component to Thatch?
Yeah, that's a great question. One of the things that's like really interesting longer term about the new way of doing healthcare is that an individual can actually stay with their insurance provider for a long period of time. And so when you think about the way the world works today, it's kind of crazy that every time you change your jobs, you're likely to get a new set of insurance policies, and by extension, a new set of doctors and perhaps a new set of prescriptions. And that drag on the system to have to like go through the friction of changing all of those critical medical decisions just because you change your job doesn't make a lot of sense. And so the future that we want to live in is one where an individual can be on Thatch, maybe they have their HSA and they have their insurance policy, maybe they have other benefits as well, and they keep that package from employer to employer, and they just update the funding mechanism. And so imagine employer one gives a certain budget, they have the same benefits, employer two gives another budget, they keep the same benefits, maybe they pay more out of pocket, maybe they pay less, but they get that continuity that I think it's hard to put a premium on. It's hard to define the value of that. But when I think about, all of the Americans who don't see a PCP, primary care physician, who haven't been to a doctor in 5 years, a lot of it's just the friction of like, oh, I have to find a new doctor now because I changed jobs. And the typical, millennial or the typical, Gen Zer, reports that they're going to stay in a job for under 2 years, in some cases under 1 year. And so I think it'll get even worse for future generations.
Well, how do you do that if the new employer is not using Thatch?
That's a good question. So, and this is kind of getting more into the business model / go-to-market strategy. But one of the things that's like kind of interesting about this model of doing healthcare is it can actually exist kind of side by side with traditional models like group coverage. And so one of the things that we think is kind of an interesting opportunity is when an individual has been on Thatch and has these set of benefits, and they go to their new employer to actually ask the employer, hey, could you cover Thatch for me instead of like the traditional model? And because it's the same budget, they can carve out a separate allocation for just that employee. And we think that that's kind of an interesting way to like penetrate into new employers with the consumers acting on our behalf. Now, if the employer says like, no way, we can't do it, et cetera, the employee can actually still keep their health savings accounts and the dollars that they have through Thatch. They just wouldn't be able to access some of the insurance and other benefits that the employer sponsors directly.
Understood. Okay. All right. So it turns out that we have 3 minutes left. So I just want to wrap up a few last minute things. First of all, as I said at the beginning of this segment, this conversation will continue in terms of what Thatch and its vision is within the enterprise on Friday on Intangify at 12 noon. And also before that show, we have our Friday slate beginning at 10 a.m. with Philanthropy in Focus with Tommy D, and at 11 o'clock with Stephen Fry's Always Friday. And I wanted to know, Chris, how can anyone, whether it's an employer or an individual employee, get a hold of you with any questions they might have, or do they have a website that they can turn to enter into the portal to learn more about Thatch?
Yes, absolutely. So the best way to get a hold of us and learn more about us is to go to our website, and that's thatch.ai. So it's short and sweet and hopefully easy to remember, but that's THATCH.ai. Okay,
perfect. I can see that Matt has left, but we will see him again on Friday. And also, I wanted to thank you again, Chris, for providing the perspective of how Thatch is doing what it can to really use what already exists, but pretty much integrate it together into something more seamless. I think it also leaves room for opportunity to include new innovative ways of, like you said, saving for long-term care issues, or doing what they need to do in case, God forbid, there's a car accident or an emergency, or let's hopefully not another pandemic. But the thing is that at least you're on the cusp of something very big, which I'm hoping over the next couple of years is going to grow even bigger. I want to thank everybody for being on this particular episode of Frank About Health, knowing that it will continue the conversation on tomorrow. And I also will just say, Chris, I'll see you tomorrow along with Matt. Thanks for being on this episode, and everybody stay tuned for our next episode next Thursday, when we will be talking with different methods of helping to deal with neurological illness. Okay. All right. So we're signing off now. Thanks again for everything, Chris, and I'll see you tomorrow.
Thanks, Frank. Thanks for having me.
All right. Bye-bye.